So, hi, I'm Louise Hoolighan. I am the stoma care nurse for the NHS Golden Jubilee Hospital in Clydebank, Glasgow. And I've been asked to come onto this webinar to basically discuss with you the kind of more from a nursing point of view, the ins and outs of travelling with a urostomy. So bear with me a moment. I'm just going to share my screen and you can see my slides, hopefully. It just takes a wee moment to pop up. So hopefully you can see those slides there now. So I'll just move on to our first slide. So a lot of people kind of ask questions about how soon after their surgery that they can travel, thinking more along the lines of flying. Obviously you can travel in the car fairly quickly afterwards, as long as someone else is driving for those first kind of 6 weeks or so. But if you were flying, it will certainly vary person to person on depending on the specifics of your own past medical history and how extensive your surgery was as to how quickly you can fly. But normally it's we would say no flying in the first kind of 6 weeks after surgery. But this can be a bit longer if you've had any complications during your surgery, or perhaps it was a more extensive surgery that your surgeon will advise you a bit longer. Most people, though, I would say, don't tend to feel confident enough or strong enough yet at that stage to be going on kind of a long flight or anything like that. I would say most people find maybe the 3-month point after surgery, they're maybe starting to feel a bit more themselves, a bit more confident with their stoma and how to manage it. So that's probably about the good time to be starting to consider going away anywhere. That being said, some people obviously, due to personal circumstances, are forced to fly a bit sooner. Maybe they've had surgery abroad because something's happened when they've been on holiday or they've been visiting family, or maybe due to the fact that their family live abroad and they maybe need someone to look after them, for instance. And so timing can certainly vary in these kind of circumstances. Obviously, the best people to ask if you're unsure is your stoma nurse and your surgeon, who can guide you as to when they feel will be the best time for you to be able to fly or kind of go far afield. So what I would say in terms of traveling with a stoma, and I'm going to focus a lot about flying, I think, because really that's the one that people are most concerned with, but I will broach on kind of traveling by car and bus, things like that. But the main thing for any journey or any holiday that you're going on is to be prepared, plan well in advance. I would always suggest to take double the number of appliances that you normally would use for that same period. So for instance, if you're going away for a fortnight, take 4 weeks worth of supplies with you. Even maybe slightly more than that if you can. Obviously, I would suggest pack half of that amount into your hand luggage and half into your hold luggage if you're flying. So if one bag goes missing, you've still got enough to last you that period of time. Some people, if they're going on a long journey, either by car or certainly on a long haul flight, might like to add a leg bag, so that like the leg bags you would use if you had a catheter, for instance, you can attach them to the bottom of your urostomy bag the same way as you would with a night bag, and that might give you a bigger capacity. Certainly for long haul flights, that could be really useful if you were unable to get up to the toilet for a period of time. Maybe there's a bit of turbulence or something like that, or you've got to keep the seatbelt on for a while. It means that you've got a bigger capacity, and also the fact that the urine is not sitting up where the seatbelt is, it's actually dropping down into the lower bag, and that can certainly make a difference to help in these kind of situations. I wouldn't suggest if you were going from, flying from, say, England to Spain, you're in the plane a couple of hours, that you probably wouldn't need that. But if you were going, around the world to Australia or something like that, it certainly would help. When thinking about what you're taking in your luggage, obviously adhesive remover sprays and scissors are a no-no for certainly for hand luggage. Some airlines also don't want kind of sprays and things like that on in the hold luggage as well. So check with your airline on the rules for that. But certainly from a security point of view, any sprays, aerosol sprays or scissors are a no-no. So avoid those in your hand luggage for certain. And I'd always suggest to make a good kit up with plenty of pre-cut bags in your hand luggage and make sure it's easy to access. So it's not too far away from you if you have to get up quickly to go and sort out your bag in the toilet. But the same thing I would say if you were in the car and doing a long journey, you know, have a little bag or something handy that you can pick up really quick if you need to get into the toilet and do anything with your bag. Obviously, if you do suffer with any sore skin or skin problems, perhaps it's not something you have all the time, but maybe you use a skin barrier or a skin protectant sometimes, but not others. I would certainly say to make sure you take that with you when you go on holiday. Obviously, your skin might be absolutely fine when you go away, but if you do run into any problems when you're away, it's best to have these things with you. That way you can self-manage and treat these problems without having to access any other kind of healthcare providers when you're away. Um, Sometimes it can be a good idea to take like a large towel or a washable absorbable pad for your bed in case of any leaks. It just helps with, you know, preventing any embarrassment or just making you feel more comfortable and safer at night, just in case any problems arise. Washable absorbable pads are fairly cheap to buy, and it's the easiest way to kind of manage that than having to take lots and lots of kind of disposable pads with you, which will obviously add to the weight in your luggage. So absorbable ones, some delivery companies do supply these free of charge, so check that out first. But you can buy them online on Amazon and places like that quite cheaply as well. And they can be quite handy at home as well. You know, so it's something you can use kind of on an ongoing basis. It's also a good idea to speak to your airline and the special assistance desk at the airport prior to your journey. They can help to make things a lot smoother for you. They can, you know, just make the whole process much easier. You can kind of plan things out ahead of time, how you're going to manage, you know, queuing and having to get to the toilet, all these kind of things. So certainly I would suggest contacting them and just be open and honest and frank about what you have, what your needs are, and they'll certainly be able to help with that. You can also get a sunflower lanyard. You might have seen these. A lot of people were using them through the COVID period, but they were basically, they were kind of came out were used a lot because of airports to start with. And it's really just a way of making what is an invisible disability visible to staff members that might be able to help you. They can ask you if you need any extra assistance, if you're, you know, needing to sit down when there's maybe a queue or something like that. It'll just make things a little bit easier traveling through the airport. So that certainly can help as well. And another thing you can get from your Stoma nurse is a travel certificate. And that can help to reduce embarrassment or language barriers, for instance, when going through security. Most of them, when you open them out, have several languages. Just telling them that you have medical equipment, that you have a stoma bag of some description, and you know, so that if you're going to get patted down, if you're getting checked at the security area, they know what to expect, and you're not having to worry about the fact that they speak a different language as their first, you know, first language, or just the embarrassment of having to, you know, tell someone. It just makes life a lot easier as well. So thinking more about when you're on holiday, if you're going somewhere hot, now that could be in Britain and, you know, it's just the summertime, or it could be somewhere really, really hot where, you know, it's 30 degrees, 40 degrees. Obviously, you've got to remember that you will become dehydrated much more quickly. So making sure that you have access to bottled water and that you're drinking plenty throughout the day is really, really important. Obviously, drinking plenty and keeping hydrated helps to avoid kidney problems and helps to reduce the risk of infection, urinary infection as well. So really important to keep well hydrated with a urostomy. It's also a good idea if you can avoid alcohol or not drink too much of it, then that will help because alcohol will dehydrate you much, much quicker. I'm not suggesting going on holiday and not drinking at all, but if you are drinking alcohol, just remember to replace some fluids with water or even electrolyte drinks like Lucozade Sport and things like that that can just replenish some of the electrolytes that your body might be losing as well through sweat and things like that. So thinking along the lines of more practical things with your stoma, I'd always suggest to try and keep your stoma supplies in the coolest spot of the hotel room or wherever it is you're staying. Storing them in a hot place in direct sunlight can affect the glue and mean that the bags won't stick. Some people take a cool bag or an insulated bag of some description to store them in the hotel room, and that helps to reduce them from, prevent them from overheating. You might also find that the water from the tap in the bathroom is not as clean as you would have at home. So you might feel safer to use water-based wet wipes, for instance, to clean your stoma, or using bottled water. If you do decide to use wet wipes, make sure that you do go for water-based wet wipes. Try and avoid moisturizers and fragrance. Moisturizers will stop your bags from sticking so well because it'll leave a layer on the skin and prevent the glue from taking. And fragrances can affect the pH of the area around the stoma and can irritate the area. So it's best to avoid that if possible. So just your plain water-based wet wipes are the best ones to use if that's what you plan to do. So thinking about on holiday, if you're going swimming, that can be something that can be, very make people very apprehensive about going on holiday. They might feel self-conscious about going swimming or even just lying on the beach, for instance. What I would say to you is that wear swimwear that makes you feel comfortable. I know that I wouldn't feel comfortable, and I don't have a stoma. I just wouldn't feel comfortable wearing a bikini. It's something I've never felt comfortable in, and so I just wouldn't do it. So make sure you feel comfortable in whatever you're wearing. If you feel comfortable, absolutely a bikini or a Speedo is absolutely fine to wear. There's no specific thing saying you have to cover your stoma bag if you don't want to. You might wear a bikini or a Speedo and wear something over the top of it, a sarong or something like that if you want to cover up but still have the bikini on top, for instance, or a man might wear a t-shirt or something like that, and that's absolutely fine as well. Basically wear what you feel most comfortable in. A lot of people find patterned or brightly coloured swimwear can be better to hide any bulges on your tummy, and also swimwear that has maybe some support in the front. So quite often you'll get swimwear with kind of panel of support there that helps to flatten out the surface as well. So that can sometimes be quite useful. But I would shop around. There's so many different types of swimwear out there now. Lots of different brands do different shapes and sizes, different things. I've even got a swim dress rather than a swimsuit. I've seen chaps in the swimming pool, my local swimming pool, wearing like an all-in-one kind of swimsuit thing. There's so many different types of things out there now that don't necessarily have to be specific for a stoma, but just, wearing something that you feel comfortable in is the most important thing there. So practical wise, thinking about travel insurance, it's always really, really important to tell your insurance company about your stoma. Make sure that your stoma and any kind of related illness is covered by your insurance, because otherwise you don't want to be stuck abroad and not be able to get health care if you need it. And shop around for travel insurance. Different companies will be different prices. You'll get quotes from other, different companies, and they can be quite vastly different. So shop around, but also shop around in terms of what is covered in your policy, because some will be more extensive in terms of what they cover as well. And some companies do specialise in insuring people with existing conditions, and that can be quite useful to get really extensive cover that you know will cover you in the event of something going wrong when you're away. So what if something does happen when you're away, and you need medical assistance? So if you become unwell or have stoma problems while you're on holiday, I would suggest that you access healthcare just in the same way as you would at home. Don't be put off because you're abroad. Make sure you do access healthcare as you would. Holiday reps and hotel receptions are always very good at advising what is available close by. Is there like a healthcare centre, a hospital nearby, all these kind of things. If you have the correct travel insurance cover, you should be covered to get medical treatment when you're away. If in an emergency, for instance, you should always access emergency services or A&E, that type thing, in the same way as you would in this country. And never leave a problem, an emergent problem, until you come home, as that will likely make you more ill. For instance, something that could happen when you're away, maybe you do get an infection. You might have high temperatures and be finding that very difficult to cool down because of the heat in the room and things like that. You might find that your urine is much more concentrated, maybe more, a different smell from it, all these kind of things that you might see with a urine infection. But if you leave that until you come home, that infection is only going to get worse. And urosepsis is very, very serious. You do not want to leave that. So if you do suspect something like that, definitely, seek help, seek medical advice, and get it treated as quickly as possible. Also, when you're away, if there are problems with your stoma supplies or bags go missing, something like that, some stoma delivery companies, as part of a world alliance, mean that you can get sort of emergency supplies from local stoma companies that are part of that same alliance. So it's like a mutual agreement between them. So definitely ask your delivery company if they're part of that, or perhaps some companies actually operate in Europe and different places as well. So they might have an office in those areas where you can access supplies in an emergency as well. So definitely ask before you go on holiday if that's something that they can offer. So hopefully that covers kind of, everything that you need to know from me about traveling with a stoma. But if there are any questions, I'm sure Samantha, that has organised the webinar, if you get in touch with her, I'm sure she'll be able to pass on any questions, and I can return back with answers there as well. All right, thanks for listening. Thank you.